disturbance in acid-base balance. pH of blood is almost constant, 7.4. The blood pH compatible to life is 6.8 to 7.8, beyond which life cannot exist. pH is equal to pKa plus log base upon acid. આ એક ઇક્વેશન છે જે pH માટે. The blood pH is dependent on the relative concentration of bicarbonate and carbonic acid. The acid-base disorders are mainly classified as acidosis, alkalosis. Acidosis, a decline in blood pH. એ બે ટાઈપનો હોય, મેટાબોલિક એસિડોસિસ અને રેસ્પિરેટરી એસિડોસિસ. મેટાબોલિક એસિડોસિસ ડ્યુ ટુ અ ડિક્રીઝ ઇન બાયકાર્બોનેટ અને રેસ્પિરેટરી એસિડોસિસ ડ્યુ ટુ એન ઇન્ક્રીઝ ઇન કાર્બોનિક એસિડ. આલ્કલોસિસ, અ રાઇઝ ઇન અ બ્લડ પીએચ. એ પણ બે ટાઈપનો હોય છે, મેટાબોલિક આલ્કલોસિસ અને રેસ્પિરેટરી આલ્કલોસિસ. Metabolic alkalosis due to increase in bicarbonate, respiratory alkalosis due to decrease in carbonic acid. Major clinical causes of acid-base disorders. Metabolic acidosis એના માટે જવાબદાર છે ડાયાબિટીસ મેલિટસ, એને કીટોએસિડોસિસ પણ કહેવાય, રિનલ ફેલિયર, લેક્ટિક એસિડોસિસ, સિવિયર ડાયરિયા, રિનલ ટ્યુબ્યુલર એસિડોસિસ. અને રેસ્પિરેટરી એસિડોસિસ માટે કોઝિસ રિસ્પોન્સિબલ ફેક્ટર છે સિવિયર અસ્થમા, ન્યુમોનિયા, breakdown of fat in adipose tissue will produce free glycerol and propionate. The degradation of glycogen in muscle result in the formation of lactate. Glucose toxicity. Ketoacidosis, increased mobilization of fatty acids, result in overproduction of ketone bodies, which often leads ketoacidosis. Metabolic alkalosis, severe vomiting, hypokalemia, intravenous administration of bicarbonate. અને respiratory alkalosis છે hyperventilation, anemia, high altitude, salicylate poisoning. એસિડોસિસ એ બે ટાઈપ છે, મેટાબોલિક એસિડોસિસ અને રેસ્પિરેટરી એસિડોસિસ. Metabolic acidosis, the primary defect in metabolic acidosis is a reduction in bicarbonate concentration, which leads to a fall in blood pH. Compensation of metabolic acidosis. The acute metabolic acidosis is usually compensated by hyperventilation of lungs. And respiratory acidosis. The primary defect in respiratory acidosis is due to a retention of CO2. Compensation of respiratory acidosis. Elevation in plasma bicarbonate. Increase in renal reabsorption of bicarbonate. પછી second type છે alkalosis. Respiratory alkalosis. The primary abnormality in respiratory alkalosis is a decrease PCO2 concentration. Compensation of respiratory alkalosis. The renal mechanism tries to compensate by increasing the urinary excretion of HCO3-. Metabolic alkalosis. The primary abnormality in metabolic alkalosis is an increase in HCO3- concentration. Compensation of metabolic alkalosis. Compensation by hypoventilation to retain in CO2. This is slowly taken over by renal mechanism. which excrete more HCO3 minus and retain pH H plus. Xenobiotics and detoxification. The term detoxification or detoxification xenobiotics refers to the series of biochemical reaction occurring in the body to convert the foreign compounds to non-toxic or less toxic and more easily excreted forms. In recent years, the term detoxification is replaced by biotransformation or metabolism of xenobiotics. Simply metabolism of foreign compounds. Site of detoxification. The detoxification reaction are carried out mainly in the liver, which is equipped with the enzyme machinery. Kidney and other organs may sometimes be involved. The product formed by detoxification are mostly excreted by the kidney, less frequently excreted via feces or expired air. Mechanism of detoxification. The mechanism of xenobiotic may be divided into two phases, which may occur together or separately. Xenobiotics phase 1, phase 2. Oxidation, reduction, hydrolysis. And second phase में conjugation and last में excreted. Phase 1, the reaction of phase 1, oxidation, reduction and hydrolysis. Phase 2, these are the conjugation reaction involving compounds such as glucuronic acid, amino acid, glutathione sulfate, acetate, methyl group. Oxidation followed by conjugation is the most frequent process in the metabolism of xenobiotics. Oxidation, a large number of foreign substances are detoxified by oxidation. Alcohol, aldehydes, amines and their derivatives. Aromatic hydrocarbons, sulfur compounds, drugs. Meprobamate is a tranquilizer. It is oxidized to hydroxymeprobamate and excreted in urine. Alcohol, methanol to formic acid થાય કન્વર્ટ, પછી ઇથેનોલમાંથી એસિટિક એસિડમાં કન્વર્ટ થાય. આલ્ડિહાઇડ્સ, બેન્ઝાલ્ડિહાઇડમાંથી બેન્ઝોઇક એસિડ બને. amines and their derivatives. Aliphatic amine-માંથી trichloroacetic urea acid બને. Sulfur compounds છે organic sulfur is oxidized to sulfuric acid. Role of cytochrome P45. Most of the oxidation reaction of detoxification are catalyzed by monooxygenase or cytochrome P45. P450. Sorry, આગળ ભૂલ થઈ હોય તમે. These enzymes, also called mixed function oxidase, is associated with the microsomes. P450. Cytochrome P450 involves the addition of a hydroxyl group RH plus O2 plus NADPH. એમાંથી બને ROH plus H2 and NADP plus. Importance features of cytochrome P450. They all are hemoproteins. 6 species of cytochrome P450 has been isolated from different animals. Cytochrome P450 species found in highest concentration in the microsomes of liver. In adrenal, they occur in mitochondria. It is dependent on NADPH, phospholipids, phosphatidylate choline required for the function of the cytochrome P450. Cytochrome P450 is an inducible enzyme. Its synthesis is increased by the administration of drugs such as uh, phenobarbital, also known as aromatic hydrocarbon hydroxylase. Reduction Citric H2OH picric acid માંથી picrimic acid બને. Hydrolysis The hydrolysis of the bonds such as ester, glycosides, amides is important in the metabolism of synbiotics. Aspirin H2O salicylic acid plus acetic acid. Conjugation Conjugation is the process in which a foreign compound combines with a substance produced in the body. Conjugation may occur directly or after the phase 1 reaction. Conjugation agents glucuronic acid, glycine, cysteine, glutamine, methyl group, sulfate, acetic acid, thiosulfate, etc. Glucuronic acid conjugation with the glucuronic acid, it is the most common detoxification by drugs. British anti-levisite used as detoxification. Detoxifying agent for certain poisons.